Harm reduction is basically a model that has just recently been brought to the field of addictions.
Harm reduction is, to me, it's a philosophy. It's a theory of working with drug users.
And basically, harm reduction, as we now define it, is anything that would prevent or reduce drug use. We reduce the harms, the social, economic, medical harms of drug use. That's harm reduction.
The ultimate goal behind harm reduction or drug policy reform is healthier, happier people. And, you don't want people having problematic drug use and unhappy and not able to get out of the trap that drugs can sometimes cause when people become dependent upon them.
Some of the perhaps implicit messages I hear are startling. Take drugs if you wish, and we teach you how to reduce the damage they cause. This is not only counterintuitive, it is plainly wrong.
Harm reduction is the standard orientation, or it's a philosophy of relating to clients that are people that are with addictions. The goal is not necessarily abstinence. The goal with someone with an addiction and going through a harm reduction approach is that they reduce the harm that it's causing them.
That's true of every kind of substance. I mean, it's probably better to chew Nicorettes than it is to smoke cigarettes. That's another harm reduction technique. Most people don't want their kids drinking, but they really don't want their kids drinking and driving, so a harm reduction technique is to say to kids, we don't want you to drink, but if you do drink, certainly you need to find some way to get home without putting yourself behind the steering wheel of an automobile.
Would you tell an obese friend, have more sweets, my dear, than get an insulin shot? Of course not. So let's be evidence-based and coherent.
We don't get in our car and we get and put on our seatbelt, not because there's no danger out there, but rather we're going to minimize the danger by putting on our seatbelt so we don't get hurt that bad if there should be an accident. That's the orientation in general medicine. That's brand new or fairly new to the field of addiction.
Eat properly, don't have dirty needles, don't receive any infections, and don't develop any abscesses or any other administrative infections. You can take a lot of heroin and be okay. Now, we don't like that, and you and I might even agree the guy was addicted, but you can prevent the guy from killing himself or getting AIDS, which is a pretty good goal, because for one thing, somewhere down the line, most of those heroin addicts will probably quit using heroin if you give them some kind of support and enough time.
Many drugs are harmful. Drugs misused can be harmful. Many drugs are useful. And harm reduction the philosophy of harm reduction is to work with people where they're at. And if they're using drugs, we work to mitigate the harms. We deal with the determinants of health. Bertolt Brecht put it very well: first feed the face and then talk right and wrong. Even honest folks will act like sinners until they've had their customary dinners.
Harm reduction on its own is necessary, but it is not sufficient. If not integrated into more complex drug control processes that start with abstinence and treatment, then harm reduction only perpetuates drug use.
Harm reduction as a part of a holistic, integrated approach can be used in a limited manner. I don't think it's an end in itself. I think it's very lazy thinking to think that someone will just have to make do with reducing the harm without eliminating it. I think it can be a gateway.
Getting us into treatment on some level, somehow, so that we can begin the process of recovery.
And in fact, harm reduction actually resembles much more standard medical treatment for most problems. You're not always able to remedy every medical problem, but what you do is you use a variety of techniques and hopefully engage the cooperation of the patient. By refusing to allow non-abstinence outcomes, we actually guarantee the worst outcomes.
Harm reduction is about being client-centered, client-driven. In some ways it's an expansion. Harm reduction is about inclusion of drug users in developing policy and services.
Ordinarily in medicine, the concept is you don't make moral judgments, but you try and preserve people's life and health. That's the ultimate goal. And you try and be neutral and value-free in doing that. But we're totally opposite in our approach to drugs and alcohol.
And to suggest anything other than 100% abstinence implies that there may be something else going on other than the biological or disease component. So harm reduction is very progressive, very provocative, but it is the cutting edge, I believe, of what how addictions will be worked with in the future.